Welcome to Lakeside Holistic Health again. I'm Dr. Jerry Bailey.
And I'm Dr. Pamela Langendorfer. In this video, we want to go over with you our philosophy of the clinic and how we view the body and how we typically approach a patient's case. So one of the things I like to explain to people is that think about your health like a tree. And with a tree, we have all these different branches, and the branches represent your symptoms. So let's say you have things like fatigue, joint pain, maybe chronic sinus issues, gut issues, and those are like your different branches on the tree. And if we just start treating those symptoms, it's like I'm putting little band-aids on your tree and I'm not really figuring out your root cause. So to figure out the root cause, we want to build a really strong foundation. And building a strong foundation starts with diet, and then we look at other things as potential triggers, and essentially we're putting a puzzle piece together and trying to figure out where your problem is coming from. And oftentimes it's not just one thing, it might be a variety of things. So when we're trying to build that strong foundation, one of the very first things that can be a trigger for some of your symptoms can be stress. And stress can be from physical stress, which could be from over-exercising. It can be emotional stress. It could also be if you're not sleeping well, or if you're having a high sugar diet, if your blood sugar is all over the place. All of those things are stressors on your body, and what that's going to do is it's going to stimulate a lot of cortisol production, which ultimately can start to impact your gut. The other thing is heavy metals. Heavy metals can be a huge trigger for chronic issues. And unfortunately, these are everywhere. They're in our water supply, they're in our food. We get exposure to them all the time. And if you have a buildup of certain heavy metals, those can cause symptoms like fatigue or skin rashes, or maybe even hormonal problems. Food is a huge trigger for a lot of chronic disease. And a lot of my passion revolves around food and trying to figure out what the right foods are for you. Food truly is your foundation for optimal health. And if we don't fix your diet, it doesn't matter what we do, we won't get you to that optimal place. So oftentimes people have what are called food sensitivities, which are technically not an allergy. And food sensitivities can happen from eating the same thing all the time on a continual basis. So what we want to do is identify what a lot of those common food sensitivities are and remove them, but also to fix your gut and to look at all these other things that might be triggering inflammation to get some of the inflammation down in your body. Medications. When people are on medications, for example, one dose of an antibiotic can alter your gut flora for 2 years. So if you have been having multiple antibiotics and you haven't done anything to fix your gut, having an overgrowth of bad gut bacteria can cause a lot of issues. And that leads me into gut infections. Sometimes from taking different medications or maybe being exposed to heavy metals, or just unfortunately all the different chemicals in our environment, all of these things can disrupt your gut flora. And that sets you up for getting a lot of gut infections, such as parasites, candida, bacteria overgrowth. So if you have some type of chronic infection going on, it's a chronic low-grade stress on your body. And then we have our genetics. And genetics are unique to all of us, and this is why one thing does not work for everybody, and this is why this is individualized medicine. So for example, if you have different genetic issues with detoxification, where maybe you're set up to not detox very well, think about if we go into a room full of paint and I detox well and you don't, you're going to get much more sick than I am from having that exposure to those chemicals. So we want to identify all of those different areas and make sure that there's not something that is wrong there that might be contributing to your overall symptom picture. And then I had talked a little bit about diet. Again, I need to emphasize food is your foundation. If you are eating something that is causing chronic inflammation in your body, we cannot out supplement or out medicate your diet. And what's going to happen is you're going to be really frustrated when you come in, because we're going to be doing these things and you're not going to see the results that you're looking for. So this is why we have a nutritionist that's on staff at the office for people that need help with this. And this is also why we'll talk about in the first visit, I encourage all of my patients to track their food, and we have them use an app for that. And you do have to weigh and measure out your food. I know that can be a little daunting for some of you, but it doesn't have to be forever, but you'll be amazed at the information we can get from that. Because a lot of times people aren't necessarily eating bad, they're just not eating the right proportions for them. And if you're overdoing something, for example, like nuts, which, you know, everybody thinks about nuts being healthy, but if you have too many of them, they can actually cause more inflammation in your body. So this is the value of being able to look at your diet. Even if you do it just for like a couple days, we can usually see a pattern there and figure out where some of your issues might be coming from. So our philosophy has really become to test and not guess. So that way we at least have a roadmap of what we need to be treating, because I can't tell you how many times over the years when we don't do this, the person spends just as much money and then more time trying to figure out what's going to work and what's not for them. So we're trying to really eliminate that time period of how long it takes us to address your health issues.
Yeah, as Dr. Pam had said, it's really important to test and not guess. We can't tell you how many times in the 18 years we've been in practice plus that it was a guesswork for a lot of people and people not wanting to do testing. Testing really gives us the key to finding what uniqueness is you, what's going on with you. And we run standard blood work, which is important to see any kind of pathology that could be going on or potential disease there. We also run some very specific metabolic testing that looks at you as you. And so that way we can really customize the plan to you and be personalized to what's going on with you versus taking everybody as a statistic and then figuring out and nailing down one thing for everybody. What it does is we look at 3 other lab works besides your standard blood work that are typical ones we run. We run a GI map test, which looks at what's growing inside your colon, whether it's parasites, bacteria, yeast, viruses, could be worms within there, and along with inflammation of the GI tract, so we see what's growing to tell us if something's going wrong. We look at the organic acids test also, which is a urine test to look at how your body's functioning, which is really key because you may have blood work that shows that there isn't nothing occurring at that point in time as far as pathology goes, but you still don't feel right, and the docs are kind of scratching their head going, we can't find anything wrong with you. Well, it's not that there's something wrong, it's just that something isn't right, and it just hasn't reached that point of having disease show up in the blood work yet. So we run an organic acids test, so it looks at how your mitochondria are functioning. So are you producing enough energy for your body to have energy? It looks at the brain and inflammation in the brain, the neurotransmitters. It also looks at the gut itself, what's growing in the gut, so it has some markers for there. It looks at the liver and kidney and how those things are cleaning out of the body, and then also looks at the cells themselves, are they inflamed? So it gives us a really good look at how your body's functioning on not necessarily a disease process, but on a functioning state, or really making optimized the way it's supposed to run. One of the other ones we run is called the Dutch hormone test, and that looks at the hormones and the stress response in the body. It's a great test to run because not only does it as a spot check for hormones, it tells us how you're metabolizing things. And that's really key to know, because if we don't know how you're metabolizing, we won't know how to give you a hormone, and we won't know how your body's processing things, because we could, or your doctor, somebody else, or us could give you a hormone. It's the wrong thing for you to do. It could make your symptoms worse because it's the wrong thing based on your natural physiology there. So those basis of what we run that you will see when you're on that first visit is your regular blood work if you haven't had that done, organic acids testing, Dutch hormone testing, and GI map. And those 4 tests are really the key things to do to figure out what's going on with you. So as our next video will show, we're going to go to what to expect on your first visit and what to have done before you come in to see us.